Welcome back to the program. Niger has further relaxed coronavirus restrictions, allowing mosques and churches to reopen. Places of worship had been closed for nearly 2 months as part of measures to contain the spread of the virus. The authorities say they are reopening them because the situation has improved. But worshippers have to adhere to social distancing rules, wear face masks, and regularly wash their hands. Mosques and churches must also be disinfected before prayer sessions or services. A dusk to dawn curfew in the capital, Niamey, has also been lifted, but hotels, airports and land borders remain closed. In a statement, the government warned that mosques and churches could be closed if the situation deteriorates. Niger has confirmed a total of 854 coronavirus cases. Elsewhere in West Africa, a fish processing plant in Ghana, where more than 500 workers tested positive for the coronavirus, has partially reopened. Ghana's President Nana Akufo-Addo said on Sunday that one worker at the fish factory in the coastal city of Tema had infected 533 other employees. Local governments and trade union officials have confirmed that the plant is Pioneer Food Canary Limited, which is owned by Thai Union, the world's top producer of canned tuna. A Thai Union spokesperson said the plant, which closed on April the 17th after an employee tested positive, reopened on Monday with a limited number of staff who had been cleared to carry out maintenance and clear backlogs. It will run with limited capacity until it is able to return to full operations. The U.S. Embassy in Tanzania is warning that there is a risk of exponential growth of COVID-19 cases in the country at a time when the government is not releasing data on new cases. It adds that the risk of contracting the virus in the largest city, Dar es Salaam, is extremely high. President John Magufuli has accused local health officials of exaggerating the health crisis. On April the 29th, the last day official data was released, there were 509 cases in the country. Of these numbers, 21 people died. While Tanzanian authorities have downplayed the extent of the pandemic, videos of night burials shared on social media have caused some to call into question the government's approach. President Magufuli has been widely criticized for refusing to order churches and mosques to close and for saying prayers can vanquish the virus. Habtamu Kehali. He's the only respiratory therapist certified in Ethiopia. Now, he is scrambling to train hundreds of others how to operate a mechanical ventilator. That's the machine used to treat severe cases of coronavirus. COVID-19 cases in the country, that is Africa's second most populous nation, is slowly creeping upwards.
Habtamu Kehali's expertise is suddenly in high demand. He's Ethiopia's only respiratory therapist and therefore the country's only expert in using a ventilator. As the coronavirus pandemic gains a foothold in the country, Habtamu is now rushing to train others to use the machines that could mean the difference between life and death.
If they are not properly applied to the patients, the risk may be more than the benefit, by the way. So, but I know. So, when we go to each hospital, we can see that from the trainings, we can see that there is a significant gap in the, in the application, the clinical applications of this machine. So, I could say that the gap is very high. So, we're trying to narrow that gap by giving these very brief, short-term trainings in line with this COVID-19 disease or outbreak.
Ethiopia's health minister says the country has around 435 ventilators, with plans to buy more, and that around 800 health professionals could operate them. But Habtamu says only very few have the necessary specialist skills.
Because of the emergency situation, we're trying to kind of make it in a crash course in two days. Like one round goes for 2 days. But that does not mean that this machine or the trainees will be able to really know everything about this machine within these 2 days. But I think that at least they can be ready. to kind of support those clinicians who would know these machines better.
He's been touring hospitals to check their levels of preparedness, and since the end of March, he has put 78 health workers through 2 days of training, condensed from an original 1-week course. Ethiopia has at least 250 confirmed cases of the disease, a tally that has almost doubled over the past 8 days. The World Health Organization says around 5% of COVID-19 infections are severe enough to require intensive care and mechanical ventilation.
Let's move now to Burkina Faso to meet a doctor making his own face shields out of folders. The general practitioner in Ouagadougou is determined to save lives and money. He has found a cheaper alternatives to scarce and pricey imported equipment to fight the spread of COVID-19 in his small health clinic. Let's take a look.
When Dr. Abdallah Ouedraogo looks at a plastic folder, he sees a face shield. The Burkinabe medic was reading a document when he came up with the idea to repurpose the plastic sheet that was protecting the paper in order to protect healthcare professionals.
We looked around to see what we could do. I thought about it very hard, and one day I fell upon a document. I wanted to open the document, and then, as I tried to open it, only the plastic came open, not the page. As that happened, I looked at it and imagined that this plastic sheet could protect us like a shield.
By adding foam and elastic, he has homemade protective equipment at a fraction of the usual price.
When we inquired about it, we found that the price of an imported face shield was around 6,000 CFA francs. But according to our calculations, with 10,000 francs, we could make 100 face shields.
Ouedraogo's inventiveness could be useful in a country with an already threadbare health system, and it's not limited to face shields. At his health center in Burkina Faso's capital, Ouagadougou, nurses make liquid soap in buckets and temporary face masks from paper towels.
When
Dr. Ouedraogo sees something that needs to be done to improve the well-being of people and the personnel, he doesn't hesitate. So I would say he's an exemplary leader.
On their own, the face masks are not a total barrier, but it's hoped they provide some extra protection. And Ouedraogo's patients are not surprised at the innovations. His passion for recycling has been on show since he took over the clinic some 2 years ago, as evidence outside, where he's made parking spaces from tires, signs from fan blades, and a roundabout from old hospital beds, complete with a sculpture of a stethoscope.
And on that creative note, we end the program. Thank you so much for watching. I'm Layo Adigoke. Stay safe.